welcome to this week's edition of NHIS in the Week. Coming up, NHIS Chief Executive on a working visit to the Ashanti region. NHIS CEO Dr. Da Costa Boaji hints of life insurance policy for staff. Kumewu Hene to NHIS boss. Kumewu is happy about your appointment. Now to our first story. Dr. Da Costa Boaji commenced his official visit outside Accra by choosing the Ashanti region, his hometown of Kumewu, for consultation with stakeholders. On the first day, he paid respects to Regional Minister Honorable Simonose Mensah at the Regional Coordinating Council.
Say about Ashanti regional tour. There's nowhere everything be jack in the FM. Say Nancy Maham representing His Excellency. Here on Mama Maria said, so about us.
Yeah, had here. Then I've been of me about 3 That's so Mr. Back on said, I didn't need tobacco food. And now the style of work very different.
Yeah.
Just listening to your staff, any board members.
During his working tour of the Ashanti region, the NHIS CEO Dr. Da Costa Boaji convened meeting with selected staff, including district managers, PROs, and drivers. He announced plans to secure life insurance policies for all staff pending board approval.
I want to offer every staff here a life insurance. And it will be on a simple formula. We will be able to offer everyone a life insurance. I will not give you the details, but because I haven't given it to the board yet, but I know the board chair being here and the board members will support the idea for us to give you guys life insurance. Thank you, sir. Thank you.
Dr. Boaji outlined his 4-point vision. I
have 4 things that I want to say in this short period. I want to see health promotion and prevention benefit package as part of our NHS scheme. The second point is I really want to see co-payment end. I really want to see co-payment end. And there is a strategy for that. The NHIA must be a pace setter in obviously issuing this card for the age between 6 and 14. And we are leading the way, and it's going to be big in Ghana.
Moving on, during his visit to the Ashanti region, the NHI Chief Executive paid a courtesy call on the Chief of Bodomase, Bafo Atatrinebua, at the Bodomase Palace. The Chief congratulated Dr. Boaji and urged management to collaborate with staff for the scheme's growth. Dr. Da Costa Boaji received a warm welcome from Setre Kumewu traditional overlord Berima Safo Trinebo Akudua at his palace. The Kumewu Hene urged Dr. Boaji to excel in advancing the scheme, especially nearing the general elections.
You feel Biara. Zio problem go popra Obahada release. Zio Baba international. Zio Dina wa tu. Zio now man also be private at the end. Zio go so van para one time. Zio and one and the man over the do so me watch. Zio I need about 7 pro so me watch. Zio that be here to me I come. Zio Zio
Berima Safo Trinebo Akudua, the Kumewu Hene, expressed joy at Dr. Da Costa Abuaje's appointment as NHIS CEO during the commissioning of a new NHIS district office complex in Kumewu. He thanked the president and the vice president for the appointment and praised Professor Edu Jemfi for initiating the building's construction.
Aye president Nanado Oniba Omia Edo Mas say Ebra aye Ogoboy efiri hon one you bia wo say ye nana aye Dr. Abuaje da Costa 2019 energy megations and 2024 ye wan the first say isi hanu na ve ene adria jese aye anidi sam samia me nana me tishie me grandson mampani adawruma wasa pija no so mambe CEO o insurance o mambe down no Ghana mention nyina na ene wono ba no so ba bi ade ya no na se akoye adekese akoye anidi sam amakuma oman Major traditional council name. That matter prophecy. That nasi papa.
Nana Sewa Mponsa Kumewu Hima has praised his son, Dr. Da Costa Abuaje, the new CEO of NHI, for his appointment and wished him well in his tenure as the new chief executive of the authority. The Deputy Chief Executive in charge of operations of the authority, Mrs. Louisa Atta-Ajaman, concluded a 3-day working visit to the Greater Accra, Volta and Oti regions. During the visit, she expressed satisfaction with the limited rollout of the NHIS biometric membership authentication system at selected healthcare provider sites. As part of the tour, the DCE operations conferred with the Jessica Municipal Chief Executive, Honorable Elizabeth Keswa Enim Ajano. Jessica MC called for proactive measures to the Jessica NHIS District Office to enable the staff to improve their performance in increasing the scheme's active membership. Mrs. Louisa Atta-Ajaman said executive management is poised to ensure that the scheme remains Ghana's leading vehicle to attaining universal health coverage by the year 2030. Now, a representative from the World Bank paid a familiarization visit to the new Chief Executive of the National Health Insurance Authority, Dr. Da Costa Abuaje. At a brief meeting to welcome the new CEO into office, Mr. Otiaje Kum, an economist with the World Bank, recounted some of the collaborative programs the bank has in partnership with the authority and hoped that the bond built in the past will be strengthened even further. Dr. Abuaje thanked the team for their visit and shared his aspiration to work assiduously to further strengthen the scheme's effort to be sustainable and attractive to the public.
Today they are here to just welcome me. So I'm happy that we've had this meeting. I've stated my mission to the World Bank, and which we will have several media engagements to put it forward. To be an addition to what is already in existence. But I believe that we need to strengthen our partnership with the World Bank and the other development partners in enhancing our national health insurance scheme.
The Quality Assurance Directorate of the authority organized a training section for external surveyors on the credentialing tool at Irata Hotel in Accra. The training aimed to refresh assessors on credentialing assessment standards, emphasizing adherence to quality standards mandated by Act 5852. Alhaji Ishmael Osei, Director of Quality Assurance, highlighted NHI's mandate in credentialing health facilities and the periodic review policy of credentialing tools every 5 years. The session included hands-on training for assessors using working tools and insights from Mrs. Lydia Anna Bisi, Deputy Director of Quality Assurance, on the review process and purpose of the training.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you son a line, ting.
Ina, look at you. What are you going to do in the office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
Now, this is how we wrap up this week's edition of NHIS in the Week. For more stories, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screens. My name is Angela Siedu. Thanks for watching.